Well, the American Academy of Pediatrics has declared child and adolescent mental health a national emergency.
Locally, there has been a dramatic increase in pediatric suicide-related emergency visits. In fact, one doctor at UW Health calls the increase a terrifying trend.
Dr. Allie Hurst is the medical director of pediatric emergency medicine at UW Health Children's Hospital. Thanks for being with us today.
Hi, Dr. Hurst. Good to see you.
Thanks for having me.
I want to make sure I get these numbers right. In 2012, there was about 15 patients a month that came in.
Right.
And last year, 2022, more than 40.
Right, 45 per month even.
What's going on?
So I think it's multifactorial. There's a lot of different things happening to children these days, and especially with the advent of social media, like added on to the pandemic that happened, just was incredibly socially isolating for them. So part of this is already we were seeing a trend nationwide and even you could say worldwide in increases in mental health issues in adolescents. And then you had the advent of social media, which isolates kids to their cell phone as their only social interaction sometimes during days of the week. And then you added on a pandemic where we were socially isolated even more so from our friends and sometimes family. Yeah, exactly. And so kids did not have that in-person connection that you should have while you're a developing adolescent to be able to figure out not only your privacy boundaries, because that's part of child development, but then also realizing what you should talk to your family and your parents about, especially when you are concerned and you are having self-harm thoughts.
There is probably nothing that makes a parent feel more helpless when your child is struggling like this. So a lot of people don't know what else to do. They go to the emergency room.
Exactly.
But what kind of resources are available locally if your child is in crisis?
So there's a couple of different things that you can do. One is talking to just your primary care provider, whether that's your pediatrician, whether that's a family medicine doctor, to try to figure out where you can get help and the help that you need right then. There's also online or texting threads like the 988 number. Not only can you call that for mental health help if you are actively suicidal, but you can also text the number and they can also help you get resources that you need.
What are some warning signs that parents should be on the lookout for?
So it's difficult because adolescents are really good at hiding what they don't want their parents to know. It's part of development. We know that this happens and it's expected. Something though that you can look out for are whether kids are withdrawn, they're not interacting not only with you but their friends, and sometimes even social media is used as an outreach modality. Kids put on social media when they have a cry for help if they are thinking about hurting themselves or if they have hurt themselves, and therefore friends can actually notify parents of other kids that have maybe gotten themselves into trouble or need help.
If a child makes any kind of a comment about harming themselves, you have to take that very seriously, right?
Because we don't know the depth of it. So some kids actually, and people in general with mental health issues, self-harm because it's actually a release. It makes them feel a different kind of pain than the emotional pain that they're feeling. And so that in and of itself is terrifying. And it's really difficult unless you're a mental health provider to know, is it because they're trying to hurt themselves, to kill themselves, or they're trying to hurt themselves for a different reason? But you don't know that until you ask.
Are some of the kids coming in marginalized?
Yes, that's correct.
And that's an added element.
Totally, because especially the fact that the LGBTQ plus population, minorities, people of color are also being affected by this way more than some other populations. They're already feeling ostracized by society, and then therefore just extrapolating this problem even further.
Do you think the pandemic exacerbated this?
I do.
How big of a factor do you think it plays?
I think it was fairly large, especially with schools shutting down, teachers not being able to recognize kids when they were at risk and when they were having any sort of behaviors or any sort of signs that they were struggling with their mental health issues. And so I think that especially also prevented us from detecting some of these things earlier on.
And we are not alone.
No, not at all.
This is nationwide, worldwide.
Exactly, which is why the AAP declared this a national state of emergency, because it is happening all around the country.
Parents, be aware.
Exactly.
Doctor, thanks for being with us today.
Thank you
for having me.
Great information.
We'll be right back.